Palpation video number 5, hip and pelvic girdle. Lucas, can I palpate you?
Yeah.
Okay, cool. So we're gonna have our iliac crest right here, and then we're gonna move inferiorly to the anterior superior iliac spine, and then even more inferiorly to that is the anterior inferior iliac spine.
This is the pubic symphysis.
Our iliac crest, and if we rotate a little inferior on the posterior side, is going to be the posterior superior iliac spine, and again inferior to that is the posterior inferior iliac spine. And then if we move medially, S1, S2, and then the sacrum. And then here we have greater trochanter. Shield tuberosity is going to be in the crevice of the glute maximus right there. We have iliopsoas right here, and that does flexion of the hip, anterior pelvic rotation, and external rotation of the hip. More medially to the iliopsoas, we have the pectineus, and that also does flexion of the hip, adduction of the hip, external rotation of the hip. We have sartorius that attaches on the lateral side and goes all the way down the femur to the medial side of the knee, and that does flexion of the hip and knee, abduction of hip, and anterior pelvic rotation. Also in the middle quadricep muscle, that is the rectus femoris, and that does extension of the knee, flexion of the hip, and anterior pelvic rotation. The medial side of the leg, we have our adductor group, our adductor muscle group, and those do adduction of the hip. And we also have the gracilis, which is another longer muscle, and that does adduction of the hip and internal rotation of the hip. Semitendinosus and semimembranosus are in the hamstring muscle group, and those both do flexion of the knee, extension of the hip, posterior pelvic rotation, and internal rotation of the hip and knee. And then in the middle we have our biceps femoris, and that also does flexion of the knee, extension of the hip, posterior pelvic rotation, and external rotation of the hip and knee. So right here is glute maximus, and that does extension of the hip and external rotation of the hip. Here we have the glute medius, which does abduction of the hip and lateral pelvic rotation to the ipsilateral side. And then deep to the glute maximus, we have the glute minimus, which does abduction of the hip, lateral pelvic rotation to the ipsilateral side. Right here is the tensor fasciae lata, and that does flexion of the hip, abduction of the hip, and anterior pelvic rotation and lateral pelvic rotation to the ipsilateral side. And that attaches to the IT band, which runs all the way down the lateral side of the leg, and attaches down at the tibia, and that stabilizes the hip and knee while walking.